Now, there's been a lot of talk about whether there's proof or not, and the government is setting a very high standard of proof before they're even willing to consider this. And, Mr. Speaker, I submit that what we need is not proof, absolute proof, to have an inquiry, because if we had it, we wouldn't need the inquiry. But what we do need is evidence, and that is what the government has been calling on. The government has been calling for evidence to back up the claims from the honourable member of Edmonton Meadowlark, and that evidence is starting to flow. Now, the honourable Justice Ministers talked about the need for criminal charges to come forward to the police if there is criminal acts. But many of the things that we're talking about, Mr. Speaker, are simply acts of intimidation and job-related actions, professional-related actions that are not crimes. But they are entirely inappropriate and they need to be investigated. I want to say that I've wondered for some time now why we can't seem to fix the healthcare system. Certainly the government throws money at it. I will give them that. They certainly put money into the healthcare system, although 2 years ago they wanted to cut $1 billion out of it. But now they're putting some money. But we can't fix it. And why? Well, I think this is one of the reasons, Mr. Speaker, that we can't fix it, and that is because we've got a culture of intimidation in the healthcare system, and people who problems for their patients, see people dying unnecessarily, are afraid to come forward. And that is why this public inquiry is so essential. We need to change the culture in the healthcare system, which has come down from the government and infected the whole system, in my view, in order to make sure that people can speak up and carry out their Hippocratic duty to speak and put their patients' welfare first. Why a judicial inquiry, or why a public inquiry with a judge, is appropriate, and what the government has proposed is not. Now, the Health Quality Council, as we've said, is not a bad organization, but its mandate is to look at health quality issues. And so I think it's quite appropriate for this body to deal with, for example, some of the problems with waiting times in emergency rooms. Perhaps it could deal with the relationship of the government's backward policy on long-term care, on waiting times. It can look at cancer waiting times. It can go back. It can examine many of these functions. But in terms, the Quality Council cannot subpoena witnesses. If someone doesn't want to voluntarily come to answer questions, they don't have to. And they can't subpoena evidence, so it can't, and they can't protect people, so they can't get to the bottom of it. They won't be able to get to the bottom of it, which is exactly what the government wants. They don't want to get to the bottom of this, Mr. Speaker, and that's the bottom line.
The Honourable Minister of Finance.